Hi, I'm Dr. Molly with Your Goals Physical Therapy. Have you been trying to squat, but you keep coming up against some inside knee pain that's just limiting that whole idea? This video is perfect for you. So squatting is absolutely amazing, but it takes all the fun out of it if it hurts. First, well, hurts, not muscle sore, hurts like this is damage, right? Muscle sore is kind of what you're looking for, at least to a certain extent. But when that intensity of discomfort gets to pain, it takes all the fun out of doing the squats. And if that's something that you've been dealing with for a long time or several weeks, it can be disconcerting. You can be afraid that you're going to need knee surgery. You could fall down that rabbit hole and think that you need to have a joint replacement or some other surgery because something else catastrophic has to be wrong with your knee, because why would squats hurt? And some people, squats were just the last straw. Other things are bothering them, but now that their squats have been impaired, they really just need to get back and figure out what is going on with their knee. So in this video, I'm going to talk about 3 main causes for inside knee pain. And then we're going to talk about ways to stop that knee pain. And in some cases, you can start that process at home. So let's get started. The first big reason why you can have knee pain on the inside of that knee, or like between, the part that's close to the other knee, right? So that part of your knee is because of passive structures. And what I mean by passive structures is we have ligaments and we have other parts of our anatomy that are fixed. Bones, ligaments, our meniscus, those things, they don't move on their own, they're just there. And so they are passive. Specifically relating to inside knee pain, you have, I'm going to bring up my little model of a knee. So specifically, when we're talking about the inside knee pain, we can be looking at the ligaments that run right along the inside of that joint that help keep these two bones together. There's actually several, this is a pretty basic model, but there are several that cross over this joint, and any number of them could be slightly torn, a little annoyed. There can be several things that are going on with this, which could result in knee pain on the inside of that knee. The other thing that's on the inside of that knee is your meniscus. That is another very common reason that people will have knee pain while they squat. And so your meniscus is a cushion between the two bones, and depending on the bone structure, how close these bones are together, if you have arthritis, if you don't, where that is, that meniscus can get torn, causing pain. So in terms of passive structures, to figure out if that's truly what is causing it, you would need to see somebody to kind of manipulate your knee to see what's happening and what structures are actually damaged and to what extent. Because a minor tear may not even be the problem, right? A minor injury to your meniscus or that ligament, you may not even really know about. And so that might not be the cause. But again, these are some of the reasons that we do get knee pain. The next thing is active structures. And what I mean by those is your muscles. So muscles can cause pain if they are being worked too hard or they're very tight. Because that we've all had muscle spasm where that muscle really contracts, and then that can cause a lot of pain. In the sense of a knee problem, what can happen, and we're just going to pick on the quads just because it's kind of easy. If you're going down into that squat, we assume a baseline amount of strength to be into that position. So whether you're talking about a bodyweight squat or something with a squat bar, you're assuming that there's a certain amount of strength. At some point, that may not be true. So everybody's fitness level is different. As you're going down, if that quad does not feel that it is strong enough, you will get a very strong sense of a pull or a grab, a muscle spasm. What's another really common thing? Sometimes people feel something very sharp, but it's your body's way of saying that is too heavy for me and that's too much work. And so you just get this, it's a nondescript to us because we don't understand muscle code, but it's your body way of saying that I don't have the strength to do that activity. Now, muscle length can also play a role in it, because if a muscle like your hamstring is very, very tight and it pulls that bone slightly out of joint, now that can cause a lot of discomfort because things are not in their right spot as you're trying to do the squat. And anybody who's done a squat realizes, especially if you've been sore from a squat, if you're just doing body weight, it's literally anything from your waist down to your feet can get sore, because squats are an amazing workout, but they use all the muscles from your waist down to your feet. And so if one of those muscles is not long enough or not quite strong enough, it can add extra stress to the inside of that knee, causing pain. Now the last thing, the mechanics or the coordination of your squat. As I just mentioned, doing a squat is not a one joint motion. It takes everything from your hips on down to your ankles. It's a lot of joints in there. And if you're adding a bar to your shoulder, or even if you're holding weights in your hand, you're now adding your entire body to that, because depending on where your head is or your trunk is held, that can be extra stress on your knee, because it all has to function in a very coordinated sense together. So if anything is not anything, I mean, like if your trunk is too far forward, if your hips are too far forward or too far back, if your ankles are turned in too much or too far out, any of those things can affect the joint above it, which will affect the joint above it, and vice versa. It could affect the joint below it and the joint below that. And so we are all one giant unit as we're moving into this squat. And depending on the type of squat you're doing, it can be a very dynamic motion. And so instead of just an easy smooth motion, but even if you're just doing a basic body weight squat or a squat down to a box and coming up, all those joints and all those muscles have a specific role that they need to play. And if the muscle length or muscle strength around that joint are not equally coordinated, it can cause inside knee pain. So those are the three main reasons why people can have knee pain. Now, that is a lot of information, and it's kind of simplified, and I did that on purpose because you can get bogged down in the mire by all of this. And anybody who's looking through the internet knows how much information there is and how overwhelming it is to figure out what exactly is going on. I still get caught in this, and I'm in the medical world. I had a kid that was sick this weekend, and it was very weird symptoms, stomach ache, and with nothing else, just a little bit of a fever. You look at Dr. Google. Dr. Google says this is an appendicitis. So I'm calling the doctor. The doctor's like, well, you do have to come in and get checked because, it could be. You go in for the physical exam, and much to my shock, my kid has strep, because apparently one of the small, random, down at the bottom symptoms of strep throat is random abdominal pain in kids. Who would have thought? I wasn't going to get there with Dr. Google. I would have never put strep throat on my diagnosis suggestions. I was dead set we were going in for CTs and emergent surgery. And so I say all that to say that it is very hard to self-diagnose. Some people are pretty good at it, but overall it is very hard to take a whole look at yourself and know exactly how equal your strength is on either side, understand muscle length, see all the coordination that's involved in a dynamic movement such as a squat. It is far easier for you to come in and have somebody put their hands on you, be able to physically check the ligaments in your knee, physically check the meniscus without having to worry about waiting for an MRI. These are things that can be checked manually. Then looking at strength and your flexibility and actually physically seeing you do a squat in person in real life. There's so much more information that you can get from 1 hour of a physical in-person visit, especially with somebody who specializes in this, than you can digging through the internet. So if you've been dealing with this and you're rightfully very scared that you may need surgery, instead of trying to cipher through all this, let me make this easy for you. I deal with so many knee problems with athletes that I've actually created an ebook. And so I will leave the link for that. It's how not to let your knee pain derail your workout. I will leave a link for that. It'll be a little button, and you can click that and you can get my best tips to getting you back to your workout despite this knee pain. The other thing that I'm going to leave a link for is if this is the exact care you're looking for, if you're tired of going through and being worried about this knee problem and you're ready to just get rid of it and deal with a specialist who does nothing but help people get back to their favorite activities, I'm going to leave a button on the bottom that says ask about cost and availability. You'll fill out a quick little form and my office will get back to you. Again, the medical field and dealing with aches and pains is very, very complicated. It is a lot easier when you can be in a room with somebody, ask specific questions, and have them actually see when the pain starts and be able to give you a reason for that. And at the end of an evaluation with me, you will know the root cause of your knee pain and get a clear path with a very specialized program just for you that'll get you back to your squats without any knee pain. Till we have a chance to talk, I hope you're having a good day.